Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
So next we'll move to the heart. So heart is located in the thoracic cavity. Backside sternum will be the superior to the diaphragm between the lungs, and tip of the heart is known as the apex. See, this is your heart. This is the apex, this is the base, and this is the surface, and this is the inferior border, superior border, left border, and the right border. So the heart pumps oxygen and nutrient rich blood to the parts of the body, cells of the body, and eliminates the waste product. So the heart has 3 layers: pericardium, endocardium, and myocardium, and 4 chambers: 2 atrial chamber, 2 ventricle chamber, and 4 valves are the mitral valve, aortic valve, tricuspid valve, and pulmonary valve. Then see, these are the 3 layers of the covering of the heart. So endocardium, that is the inner one which lines the heart chambers and the valves, and it is very smooth lining, thin lining. It will reduce the friction of the blood flow through the chambers. Okay, and the next is the myocardium. See the picture. This is the myocardium. So it is the middle thickest layer of the heart. It contains some muscle fibers which is responsible for the pumping of the heart. So contraction of this layer leads to the flow of blood through the blood vessels. So next we'll move to the heart. So layers of the heart is over, pericardium is over. Next we'll move to the heart. So heart is a hollow cone-shaped muscular pump, and it beats almost 2.5 billion times in your entire lifetime. And left side heart pumps blood through an estimated 120,000 kilometers of blood vessel. So that is almost equal to the person which is traveling around the Earth's equator about 3 times. So you can imagine what is the pumping speed. The right side of the heart pumps blood through the lungs. So it will enable to take the oxygen and unload the carbon dioxide. And heart pumps more than about 14,000 liters of blood in a day. That means 1 year 5 million liter. Understood, Nirisha?
Yes, ma'am.
Next, about the dimensions of the heart. So as you know, it is a small organ, 12 centimeter long, 3.5 inch width, and 9 centimeter or 3.5 inch wide at its broadest, and 2.5 inch or 6 centimeter thick, and 250 gram in the case of female, and 300 gram in the case of male. So the heart rests on the diaphragm near the midline of the thoracic cavity, and it lies in the mediastinum. It extends from the sternum to vertebral column, from first rib to diaphragm between your lungs. And next, about the relation with the heart. So superiorly, what all relation? Aorta will be there, pulmonary trunk will be there, superior vena cava will be there, inferiorly diaphragm, anteriorly ribs and intercostal muscle, backside esophagus, trachea, bronchus, aorta. Correct, no?
Yes, ma'am.
Laterally what will be there, Narisha? Heart laterally what will be there? Lungs. Okay. So
Lungs.
the heart is having apex. Apex will be pointed into down. Correct, no? So apex is formed by which part of the brain? Which part of the heart? Which chamber?
Ventricles, ma'am.
Ventricle. Very good. Left ventricle. And base is formed by which chamber?
Auricles.
Very good. So the next, about the surfaces. So there are 2 surfaces: sternocostal surface or anterior surface, and diaphragmatic surface or inferior surface, that is the part between your apex and the right border, and left surface, that is occupies the cardiac notch of the left lung. Okay. So see here, this is the superior border, right border, left border, inferior border. This is the apex. Clear?
Yes, ma'am.
Then the borders. Right border is formed by right atrium. So it extends from the from where to where? Inferior surface to the base. And inferior border, which is formed by which chamber, Narisha?
Sorry, ma'am.
Inferior border, how it is formed? Which chambers are take part for making this inferior border?
Ventricles, ma'am.
Ventricles. Yes, ventricle. Right and left ventricle. The left border?
Lungs.
Left border of the heart, which is formed by which chamber?
Chamber.
Chambers only forming the borders, right?
Yes, ma'am.
So which chamber will form the left border?
Left auricle, ma'am.
Left auricle and the left ventricle. And superior border, which is formed by the atria. Okay. So these are the basic things. I'm not going to the basic things of physiology. Actually, it is how it is working and all. So first we will go to the right atrium. That is more important. So which is forming the right border of the heart. Okay, so the right atrium is 2 to 3 mm in thick. And if you are taking the right atrium inside or interior of the right atrium, it is divided into anterior and posterior part. Posterior part is rough. Posterior part is smooth and anterior wall is rough. Why the anterior wall is rough? Because there is a muscle ridge that is known as pectinate muscles. I'll show you. Okay. And the right and left atrium is separated by septum, that is interatrial septum. And there is a prominent feature in the septum is an oval depression that is known as fossa ovalis. Okay, then the blood passes from right atrium to right ventricle through a valve that is known as tricuspid valve. So it consists of 3 leaflets or the cusp.
Okay.
So see, this is what I was telling. This is the open piece of the right atrium. So here you can see what all things you are able to see. There is a depression. This is known as fossa ovalis. And this is known as the edge is known as limbus ovalis. And this is the one I told you. The anterior part is rough. Why? Because here you can see some ridges. What is that? Musculopectinate.
Yes.
And this is the posterior smooth part. Here you can see fossa ovalis, limbus of fossa ovalis, and back of that you can see the valve of inferior vena cava, and this is the valve of coronary sinus and opening of the coronary sinus. Is it clear?
Yes.
Right atrium is clear. So here you can see there is a tricuspid valve. See the tricuspid valve? So the cusp of the tricuspid valve are connected to tendon-like structure. So this tendon-like structures are known as chordae tendineae. So this chordae tendineae is connected with one muscle, that is papillary muscle. Okay. So your right atrium is over. Right atrium, what all things you studied? And can you summarize the right atrium?
Yes, ma'am.
Tell me.
Right atrium, there is a oval-like depression is there, ma'am. That is called fossa ovalis.
First you start from here. No, anteriorly rough part and posteriorly smooth part. Why anteriorly it is rough? Because there is a muscular ridge that is known as musculopectinate.
Yes, ma'am. And right atrium and right ventricle is divided by a valve called tricuspid valve. And
okay, fine. All right. No issues. I'll give some time to read that. Let me finish the chambers. The next is the right ventricle. It is 4.5 mm in average thickness, and anterior, it forms the anterior surface. Right ventricle forming the anterior surface of the heart, and right ventricle which contains some ridges, which is the ridges are formed by the cardiac muscle fibers. This cardiac muscle fibers are known as trabeculae carneae. So this will help for the heart conduction. And right ventricle is separated from the left ventricle by the interventricular septum, and blood passes from right ventricle through pulmonary valve into a large artery, that is the pulmonary trunk, and it is divided into right and left pulmonary arteries. Okay, see here, this is the tricuspid valve. So here it is divided into anterior cusp, septal cusp, and posterior cusp. So here you can see the trabeculae carneae. This is the anterior papillary muscle. This is trabeculae carneae. So these are the posterior papillary muscle. So here you can see the septal papillary muscle. and this is the conus arteriosus. This is the pulmonary valve. So this is the interior of the right ventricle.